Hi, I'm Terry Farr with the Greater Picayune Area Chamber of Commerce. I'm the Executive Director, and we're having chamber conversations today where I do on a regular basis have conversations with entrepreneurs and employees. And today I'm lucky and fortunate to have Dr. Adrienne Penley with me. And Dr. Penley's practice, Penley Family Dentistry, is located at 6480 Highway 11 North, Carrier, Mississippi. And so, Dr. Penley, I'd like to welcome you today.
Thank you.
Appreciate you being here.
Thank you.
Dr. Penley not only is a dentist, but she's also, of course, a member of the Chamber of Commerce. She's on our board of directors, and she also is a sponsor. So we appreciate everything that you're doing for us,
Thank you
very much.
I'm happy to be involved.
Good. So what we want to do today is just carry on a little conversation and find out a little bit more about yourself and your practice and whatever. Could you give us maybe a little bit of background on where you grew up, where you went to school, K through 12, high school, college, well, I guess it'd be K through 12, where you went to college and dental school?
Sure. Well, I was born here in Picayune, and where I attended K through 12 here, and then I got my start in college at Pearl River Community College, and then from there I went to the University of Southern Mississippi where I received my bachelor's degree, and then I wasn't quite sure what I wanted to do next. I was always interested in being a dentist, but I didn't know a whole lot about the profession. So I got married. My husband was in the military. We moved to Japan. While in Japan, I had the unique opportunity to, the American Red Cross had a volunteer dental assistant training program. So I knew that would be great for me to find out more about the profession I was interested in. So while I was there, the turning point happened when there was one patient in the chair that she just started crying tears of joy upon completing her treatment. She was so happy. She was able to chew again. She was out of pain. She could smile again. That was the turning point where I said, I want to be able to do that. I want to be able to help people in that way. So I decided to come back to dental school, back to Mississippi, where I attended the University of Mississippi Medical Center Dental School, and that's when I got my dental degree.
Cool. So you actually answered a few questions that I would have asked.
Yes.
So you didn't just wake up one day and say, I want to be a dentist.
No, I did some research.
Yeah, or you didn't have one of your best friends say, you have such pretty white teeth, you ought to be a dentist.
No.
Okay.
But people don't believe I have real teeth. They ask me all the time if my teeth are fake. So they're real.
People see my teeth, they know they're real. But anyway, so when I was at USM, one of my buddies that I met, he was going to be a dentist, and he had to study all the time. I mean, he wasn't like the rest of us that probably didn't do as good as him in school. So was dental school real intense?
Yes, it's very intense. We had 12 plus hour days. After class, we would go to lab. And I vividly remember bringing my lab kits home so I can make dentures in my living room to spend some time at home with my husband and trying to relax somewhat before I go to sleep and get up and do it the next day. So yes, we even brought it home with us on the weekends.
So walk us through a little bit on how you started your practice here, and was that like a planned event, or when did you start your practice here, and why Picayune? Why'd you come back to Picayune? Give us a little bit more detail on that.
Well, I make my 4-year anniversary being here as a practice owner next week. So that's exciting. My husband and I are both from the area, so we knew we wanted to come back home, but we weren't sure exactly how we were going to get here. Then the opportunity came up for me to buy Dr. Lambert's practice, and I'm very honored that Dr. Lambert and Teresa chose me to continue to grow their practice. So I'm happy to be here. I feel very blessed to be here, and that they gave me the opportunity to move back home as well. So Dr. Lambert had a great foundation, and I've just been building on that. So it's been really great.
He was a fine fellow.
Yes.
So let me ask this. Was there anything in dental school that maybe they didn't teach you that you wish they had?
Yes. So I had I received an excellent education from the University of Mississippi Medical Center Dental School. They focused on helping us take care of our patients, but what I wish we had more time to do is focus on the business aspects like management, scheduling, taxes, employees, patients, the whole gamut of owning your own practice. So that's been a challenge. Fortunately, I have family and friends and colleagues that I can call on for advice and support, but every day is a day of learning.
You know what I think's neat, and again, this will be another question that we'll probably get to, is how I get text messages for different appointments, and so I'm sure they talked about all the software packages in dental school. And
no, none of that, none of that. So there's so many products and so many people that come by trying to sell more products and trying to discern, you know, what's right for me, what's right for my patients, what's the best where to spend the money, and it can be very challenging and overwhelming sometimes.
Well, and I know you've got a good staff, so that helps out. And,
yeah, you can't do it without a great support staff, because every day there are new challenges every day.
Yeah.
And so they help our patients and me and everybody get through that and hopefully have a good experience and a good day.
Let me ask you this. So what do you get excited about, assuming that you do, get excited to jump out of bed every day and come to work? What really gets you excited about your day?
Well, I like the excitement of the day as far as I just like being a dentist and being able to focus on that and taking care of my patients, because even though we have a schedule, I walk in and you don't really know what's going to unfold during the day. And that's exciting to me, because somebody comes in with a broken tooth, we might be able to save it and do a crown or a root canal or an extraction. So, you know, that excites me, being able to make those decisions and not have everything so scheduled and planned during the day.
Right. So if there was just one thing, because I know, you know, most of us are probably pretty good at a few things and not good at a lot of things, or I'm speaking for myself. If there was just one thing that you could say, man, if I could just do this one thing all day long, I'd probably work 20 hours a day. What would be that one thing?
Well, it's always great.
And it might be sort of the jumping out of bed question, you know.
Well, it's always great when patients can save their teeth. That's always the best thing. But probably the thing I enjoy the most is extractions, because usually somebody's in pain. And it's almost instant gratification. We're done with it. We pull the tooth. It's done. We can move on. Let's make decisions on replacing that missing tooth. But most of the time, it really helps patients when you can see them the same day that they're in pain and relieve their pain in the same day. So I think that's why I enjoy extraction so much.
Well, and in today, especially with all the electronics and the software and all that stuff that people are coming by and trying to see and whatever, we're seeing so many changes with so many businesses. I mean, my thoughts are you can't keep on doing things the way that you used to. And I think of growing up as a kid. I mean, there wasn't a whole lot that the dentist didn't appear to be a whole lot that the dentist did back when I was a little kid. They you know, put in these silver fillings and, you know, and revive me from passing out and stuff like that. But y'all do so many things today. Can you elaborate maybe on some of the things that you do that maybe 10, 15 years ago dentists didn't do?
Yeah, well, one of the newer things that was just recently passed last year by the Mississippi Dental Board was to allow us to do Botox injections. Of course, patients know about that for cosmetic reasons, but in the dental world, we can relieve TMJ pain and trigger point therapy. So when people have problems clenching and grinding and wake up in pain, we can do a small, simple, easy, quick Botox injection, and it gives them pain relief. So that is very nice to be able to do that. Another new thing we have in our office is the ability to do digital scans. So we can scan a patient's mouth, and if they need a crown, we can send it to our in-office milling unit and mill the crown the same day. So that's been really nice. Another thing we can do is send the scan to a lab, where the lab can print out 3D models of that scan and make oral appliances. So that's why I like dentistry as well, because the technology is always changing. It's exciting. There's something new coming out all the time. So I really enjoy that aspect of dentistry as well.
So So you have to learn so much, and you learn as you go. Are there any tips? I mean, I don't know who all is going to be watching this, so you know, there may be some chamber members that let their high school students, you know, watch this video. Have you got any recommendations for either maybe somebody that's in school thinking about becoming, you know, self-employed, or either maybe somebody that has a job that just says, you know, really want to work for myself? You got any tips?
Yes, take business courses as much as you can, learn as much as you can, talk to other business owners and learn from them, so hopefully you can avoid some of the pitfalls that they came across. So learning from others is the best way. Yeah, take as many college courses and business courses as you can.
Well, that makes a lot of sense.
Yes.
So of course you know, you're back in Picayune. Your practice is in Picayune. You're probably not going to pick up and move. So do you recommend? I mean, do you think Pearl River County is a good place for someone to start a business and grow a business?
Yes, definitely, because Pearl River County is really growing because it's attracting people from the surrounding larger cities like New Orleans or the coast or Hattiesburg. They're moving to Pearl River County area to avoid the hustle and bustle of the larger cities. So a growing city or a growing county is always a great place to have a business.
Good. Good. Okay. So what question or questions have I not asked you that you would like to cover? Or is there any final words, anything that you'd like to share that we hadn't talked about?
Sure. I'd like to take a minute to talk about some of our unique services that we offer here at Penley Family Dentistry. I mentioned the Botox, which is cosmetic and TMJ therapy. We also place and restore implants here. We also have...
Did you look at me like that for a reason?
No.
Okay.
We have oral conscious sedation as well to ease any patient anxiety so they can get their work completed while they're nice and relaxed. And we have 6-month smile adult orthodontics. So you can have a nice straight teeth and pretty smile by your next cleaning. So.
Sounds nice and easy.
Yeah, and simple.
Okay. All right. So let's see. What else did... all right. I don't think I have any more questions. So how can the viewing audience get a hold of you? What's your telephone number, website, or what's the best way to get a hold of you or your, you know,
Sure.
information or your practice?
The best way is probably to call our office at 601-749-9330. The other way is through our website, which is penleyfamilydentistry.com. And we also have a Facebook page, so you can like us on Facebook or send us a message on Facebook. Those would be the best ways, or come by and see us.
Good deal. Well, I'd like to thank you for
Thank you.
being here and having this conversation. So be looking for more conversations on our chamber conversations, and we'll be putting this out in several platforms. So if you will, be sure to subscribe to our YouTube channel, and we'll see you soon. Have a great day.
Yeah, thank you.